Veterinary Medicine Digital.
Have you heard? Administering famotidine intravenously in cats appears safe when given slowly. Administering famotidine intravenously has been anecdotally associated with intravascular hemolysis in cats, but the actual risk of this adverse effect is unknown. The reaction is postulated to be due to a chemical and not an immunologic reaction because it occurs immediately after one or more doses and not after a sensitization period. In this study, clinicians at the University of Wisconsin School of Veterinary Medicine evaluated whether hospitalized cats that received famotidine intravenously had a clinically significant decrease in packed cell volume compared with hospitalized cats given famotidine subcutaneously or compared with cats that didn't receive any famotidine. The clinicians reviewed a 3-year span of the teaching hospital's medical records and identified all cats hospitalized for at least 24 hours in the critical care unit and prescribed intravenous or subcutaneous famotidine, as well as cats that didn't receive any famotidine. Cats treated with famotidine were included in the study if their PCV had been measured up to 12 hours before and within 24 hours after receiving the drug. Cats that didn't receive famotidine were included if their PCV had been measured on admission to the critical care unit and again during hospitalization. Cats in all 3 groups had also received intravenous fluids during hospitalization. 56 cats were included in the intravenous famotidine group, 48 in the subcutaneous group, and 38 in the control group. Most of the cats were domestic shorthairs, and all 3 groups were of similar age, sex, and body weight. The intravenous group was observed for a median of 41.5 hours, the subcutaneous group for 44 hours, and the control group for 36 hours. A median of 2 doses of famotidine was given to both treatment groups. Intravenous famotidine was administered by attaching a syringe to a fluid-lined port and injecting the drug over a period of at least 5 minutes. The results showed that the cats in both treatment groups had significantly lower PCVs at baseline compared with the control group. Thus, not unexpectedly, more cats in both treatment groups were anemic at baseline compared with the control group, but this difference was not significant. Given their lower baseline PCVs, both treatment groups also had significantly lower PCVs after receiving famotidine than the PCVs of the control group. However, importantly, the median percent decreases in PCV, which were 3 to 4%, did not differ in cats that received intravenous famotidine compared with cats that received subcutaneous famotidine and the cats that did not receive famotidine. In addition, none of the treated cats had clinical signs of hemolysis. The clinicians suggest that because the cats that received intravenous and subcutaneous famotidine had lower PCVs both before and after treatment, the cats treated with famotidine were sicker at admission than the cats that didn't receive famotidine. The clinicians also suggest that 0.9% benzyl alcohol included as a preservative in the multi-dose injectable formulation of famotidine may be responsible for the anecdotal observations of hemolysis in cats. A similar concentration of benzyl alcohol has been associated with hemolysis caused by red cell membrane disruption in human erythrocytes in vitro. However, the clinicians state that this amount of local concentration of benzyl alcohol should be well diluted by slow intravenous infusion. Limitations of the study include lower surveillance for the adverse effect than that of a prospective study, the small number of cats treated with famotidine intravenously, and the fact that many clinicians, rather than a few designated observers, perform the clinical evaluations. The study's authors conclude that intravenous famotidine administration in this small population of ill, hospitalized cats did not cause a clinically important decrease in PCV, and that intravenous famotidine administration appeared safe when given in a fluid infusion line over 5 minutes.